A warm welcome to the DigitalHealth.London 101 webinar. The Digital Health London Accelerator programme supports some of the best and highest potential innovations that can transform and support the NHS. Now in its 5th year, it remains sector leading and highly competitive. I am Sara Nelson and I'm the Programme Director of the Accelerator programme, and I'm also a nurse of 25 years service. I am immensely proud of the impact and transformation that many of our companies and the NHS organisations we have worked with over the past 5 years have achieved, and you will hear about some of that today. As a nurse by background, I remember the first time technology came into my working life. That first computer coming into the coronary care unit where I was working, and being far more scared of the new technology in front of me than I was about the life or death situation of my patients. I was a trained and experienced nurse at that time, but I had no idea how technology was going to impact me, not only on the way I worked, but on the way that we as a team worked and the lives of our patients. At the DigitalHealth.London Accelerator, when working with NHS organisations and companies that have been successful in getting into our programme, I often think about that moment, about the fears of something new and the importance of doing the right thing for our patients. Bringing digital innovation into healthcare is not just about technology, it's about the staff who use it and the patients who can benefit from it. Working together in collaboration, understanding the benefits and the challenges of everyone involved is how you really make a difference. We're open for applications for the 2020-2021 Accelerator programme, and we're looking for the next generation of digital health innovations that can support our NHS and help patients to better self-manage. Today, we're going to be discussing the programme to help you decide if the DigitalHealth.London Accelerator is the right programme for you and your business. And if so, I would encourage you to apply. I'd now like to hand over to Ruth, one of our new navigators from the last year, who will explain about her programme and how the navigators and innovators can work together over a year-long programme. Ruth.
Thank you, Sarah. Hello, everyone. I'm Ruth Bradbury, and I'm an NHS navigator with the Accelerator programme. I'm a speech and language therapist by background and have worked in the NHS for over 20 years. My clinical and management roles have focused on service delivery to community, acute and secondary care outpatient settings, with a specialist interest in long-term conditions and older people. Latterly, my management roles took me to the world of quality improvement and transformation, with opportunities to work with CCG and STP stakeholders to achieve widespread change to the health and care system. I joined the Accelerator, as Sarah mentioned, last year for the start of cohort 4. And for the last 12 months, my eyes have been open to the exciting and vast world of digital technology. My clinical and management roles have always involved technology, from using communication aid devices and apps and navigating the complex world of data security and IG to set up a communication aid service for patients, to designing the functionality and implementing our clinical EPR system to meet the needs of clinician users and to support data reporting. My passions for transforming clinical services and working with technology make the Accelerator a perfect fit, a way to influence innovative transformational change. It has been most exciting to watch how our SMEs have grown and developed, taking on our advice and support to make themselves NHS ready. Each navigator works with around 5 to 6 SMEs, and our role is to be a dedicated point of contact and champion for the company. This year, I've supported a range of different companies, each aiming to impact a different aspect of the health and care sector. Home care, radiology imaging for Crohn's disease, virtual outpatients, digital staff banks, personal health records, and self-management for cancer patients. Our navigators come to the Accelerator with different clinical or NHS management backgrounds. Our NHS knowledge and experience make us well placed to understand the health and care sector priorities and how they work. In addition, we also utilise the knowledge and experience of the wider Accelerator team and other healthcare and industry partners. Critical to the success of our role is getting to know the company in depth from the perspective of both the team and how the business works. If we have this deep and close relationship, we're in the best position to understand the support and opportunities that companies need to advance their spread and adoption into health and care services. The bespoke support and guidance provided by the Navigator is directed by quarterly objective setting meetings. Navigators support their companies to identify areas of development need. This usually includes business development and accessing investment opportunities, evidence generation and research collaboration in accordance with the NICE framework for digital technology, and advising on and supporting marketing and comms using the Accelerator brand to amplify their story. Another very important area of activity for the Navigator is supporting the company to build up a network of health and care stakeholders and facilitating engagement with health and care teams who are looking to adopt digital innovation to transform their clinical services. During this time of the COVID-19 pandemic, Navigators have been involved in NHS initiatives like TechForce 19, and we're actively supporting our companies to apply for domain-specific bids and tenders. Our positioning gives us valuable insights into how the health and care sector is responding to the pandemic, and this in turn puts us in a favourable position to advise our companies how to respond. Our regular touch points with our companies may be weekly or monthly, and the frequency is determined by the specific Navigator SME relationship. Importantly, they are there to maintain activity momentum and ensure that the engagement is focused. Some of my best Navigator experiences have been with companies who use me as a sounding board, ask for advice, or trust me to make contacts across their clinical networks. I've really enjoyed supporting these teams and feel privileged to have been part of their journey into working with the NHS and social care. Thank you. I'll now hand back over to Sara.
Thank you, Ruth. We'll now hear from Dr. Jo Garland, the Clinical Director for Infinity Health. Jo was on our second cohort and will be able to give you valuable insight into how to get the best out of the programme.
Thank you, Sara. So, as Sara said, my name's Jo Garland. I'm a GP by background and Clinical Director at Infinity Health. Infinity Health is a digital health company that provides a platform for healthcare professionals in multidisciplinary teams to easily log, share and coordinate their tasks in real time. So this replaces inefficient manual, paper and whiteboard processes and saves a lot of time for the healthcare professionals, reducing calls and bleeps to chase information from busy colleagues. It's basically making it safer, more efficient and giving good tools to healthcare professionals. So I just wanted to give a few insights into my experience as an Accelerator. It was a really big privilege being part of DigitalHealth.London Accelerator. The Accelerator really wants to help SMEs who are serious about making a difference in healthcare, and it was instrumental in getting our first implementation, which was at London North West University Healthcare Trust. As a team, we went into the Accelerator knowing the NHS. I'd worked in various community and hospital roles, but we didn't know the best way to get into the NHS. And what DigitalHealth.London Accelerator did was it really opened doors and also gave you a massive stamp of approval. Helping you navigate the NHS is a really important role. And the navigators, as Ruth just was talking about, are an amazing way to help you. They get to know your product really well and your company really well, and they connect you to people who you wouldn't otherwise easily have access to. Some of you probably know the challenges of getting into the NHS are huge. Who do you speak to? We often have a lot of clinical champions, but they're not the decision makers. And for us, it's a multi-stakeholder sale. You have your clinical champion, and then you have to have the managers and the CIO and finance people. There's a lot of people involved, and it's really complicated and complex. To find the key people in each trust takes a lot of time, and you often go through many different people to get to that right person. And they often then move around. In the NHS, people moving all the time. So you've just got a relationship with someone and then they move. So it's very frustrating and really helpful to have the team at DigitalHealth.London to help you get through this. The other thing is that the DigitalHealth.London team help you really sort of ram home to you how you have to address the trust priorities at the right time. There's no point, you can have the most amazing idea, but if it's not what that trust is looking at that moment, not what they have finance and budget for, kind of wasting your time. And you have to be flexible to solve the problems that are relevant to them at that time. So a lot of advice and how to approach trusts and who to approach came from Digital Health London. Then there's all the workshops and all the events that they arrange, which they provide experts so you can learn so much. So for example, in sales and marketing, there were lots of workshops on that, and I learned a huge amount from that. Introducing you to health economists who we wouldn't otherwise have had access to help you build a robust business case, to help you define your KPIs, talk to you about the relevance of evidence generation and the value of data and the complexity of gathering data and evidence and evaluating your product in situ and the impact that that had on other things. They introduce you to the academic health science networks. I don't know if you've come across them. There's 15 around the country, and they are very useful in giving advice, helping you with grant applications and also the health economics. There were workshops with investors giving you financial advice, and also pitching events where you got good at defining your product and pitching to key stakeholders in trusts and CCGs. Other things that we got from being part of Digital Health London Accelerator was meeting and building relationships with the navigators. You have your own navigator, but you get to know all the others as well. And these are such a valuable relationship, and we are still in contact years later with all the people that we worked with because of the good relationships that we built, and still go back to them regularly to discuss things, get advice. And of course, you meet the other excellent digital health companies on your cohort, who are all equally passionate and enthusiastic about what they're doing. You learn a lot from their experiences, from talking to them, and you can have potential collaborations. We've got a lot of friendships and hopefully long-term working relationships for joint ventures that we built during our time on the cohort. So top tips for any SMEs looking to apply. I think as a company, you need to be ready to apply to Digital Health London and not just have a concept, but have an actual product. And most importantly, I think you have to have bandwidth in your team to attend all the events. It really is a case of what you put in, you get out. We attended everything that we possibly could, even events that we didn't know if they were directly relevant to us, but it gave us exposure to different areas that we might not otherwise have considered. So I think if you're a team who don't have that many people, or you're spending a lot of time fundraising or other things, may not be the right time for you to join. And I really would highly recommend, if you did join, to go to absolutely everything and really jump in and get what you can out of it. And it's the best thing we ever did. I really highly recommend it.
Thank you, Jo, for your insights. I'd like to now ask Dr. Debs, who has joined our programme this year and is able to tell you about the impact of being on this programme, even in these unusual times.
Hi guys. So my name's Dr. Das. I'm a cardiologist by trade, working at the Barts Heart Centre in London. And I've been working with kind of Digital Health London for the last 3 years in some way or capacity. But the last year has been more formalised with my own company in the Accelerator programme. Ortus-Heatlh is a remote monitoring platform that specialises in trying to ease the burden of high complex patient follow-up, tie that in with a patient portal and appointment management to try and produce a solution that a trust can roll out very quickly to deliver remote high-touch care that is still consultant-led but remotely. So as you can imagine, in the current COVID pandemic, quite topical. But I won't talk too much about that, because this is all about the Accelerator and what the Accelerator brings. I mean, fundamentally, since when I started working with Digital Health London, it was far more of a kind of a Wild West in terms of digital health. And you've seen over the last 2 to 3 years, the foundations of robustness being put in. NHSX, there's far more scrutiny now on digital health products. And quite fundamentally, the Accelerator is the biggest rubber stamp that you can get. If you look at any products that are out there that have made any kind of success, I would not probably find in one hand that have not gone through the Accelerator. So what did we find? If you come into the Accelerator, and I think this is what my view is as I come in as a company. If you come in as a company that this is going to be a sales generation exercise, you completely miss the boat or misunderstand the point of this. The Accelerator takes your company and looks at it from every facet, of which sales generation is one, but looks at your value proposition, looks at your KPIs. How do you really generate the evidence required? And I would treat it as almost like a certificate or a program. If you're going to university for a year to then go flourish afterwards. And if you come into that with that mentality, I don't want to go through the same things that Jo has said, because she's very eloquently talked about all the things that the Accelerator provide. But if you come into the mentality that you're going to analyze your business from inside out and then use this year to make contacts, generate evidence, it will put you in the best footing to really expand. And that is what my feeling of the Accelerator is. It's giving the grounding of companies to take their product and go out to the market. It gives you exposure to the rest of the country. Again, anything that is worth anything in the digital health space has come through DigitalHealth.London. We've presented all over the country this year, and that's largely been through the rubber stamp of the Digital Health, the Accelerator program, but also contacts. They provide access to individuals that a lot of SMEs will not have the experience or in. So some companies are very clinician heavy. So, and you may not have insight in fundraising, getting your value proposition from a marketing perspective. Some companies are very tech heavy and don't have clinician expertise. So they can give you access to that. So it really does give you a grounding in the process. What would I say was the most valuable exercise? I think, especially now when the digital space is so much more bigger, would be to come in and then really work out what your value proposition is. To stand out in this current climate is even more difficult. There are lots of products producing the same thing on paper. So you will really have to stand out and decide how you can be better than the rest. And the Accelerator will help you do that. I think I'll finish with the fact of the matter is a great program. The fundamentals are there's going to be far more people applying than actually get in. And that's the testament to the program itself. It is highly sought after because it produces.
Thank you, Debs. We have heard now from Ruth and Jo and Deb. From Ruth, you've heard about the program and how we as navigators and a core team can support you. You've heard from Jo and Deb about how the impact of the support can help you as a company. I want to thank both Jo and Deb for their commitment and your ongoing engagement with us. As you are aware, there are multiple accelerators out there, and each are subtly different. Ours has NHS staff supporting you as a company and an individual through passion and enthusiasm, knowledge and skills. It works through relationships with innovators and the NHS organisations. And if this appeals to you, then we would encourage you to apply before the deadline for the Accelerator programme. Thank you for listening.